Thank you for coming back. I am presenting the agonizing journey of a kidney stone, a case study of John's experience. John is a 35-year-old male truck driver with a history of lower back pain, arrived at the emergency room on a Saturday night with severe right flank pain. The pain began suddenly 2 hours prior and has since intensified to a sharp, stabbing sensation that radiates to his lower abdomen and groin. John is also nauseous and intermittently vomiting. Despite taking Advil, the pain has not subsided, and he appears visibly uncomfortable, constantly adjusting his position. During the examination, John's vital signs were generally normal, with only slightly elevated blood pressure due to the pain. However, tenderness and guarding were detected in the right flank region, and blood tests revealed an elevated white blood cell count and serum creatinine. Urinalysis showed the presence of red blood cells, nitrates, and leukocyte esterase, indicating a possible urinary tract infection and blood in the urine. Further information will be provided upon receiving the results of the urine culture. In addition, John underwent a non-contrast CT scan of the abdomen and pelvis, which revealed a 6 mm stone lodged in the distal section of the right ureter, causing mild hydronephrosis, which is a partial blockage in the urinary tract. John has been diagnosed with a partial obstructive kidney stone, which explains his intense pain. Kidney stones can cause sudden, severe pain when they move into the ureter. The location of the stones determines which body parts the pain can spread to. Upper ureter stones can cause frontal pain, while lower ones can extend to the testicles or labia. Some patients may also have painless blood in their urine. The appropriate treatment for kidney stones varies depending on factors such as the size and location of the stone and the individual's health status. For John, the urologist recommended conservative management. The likelihood of a stone passing on its own depends on its size and position within the body. Stones greater than 5 mm in the proximal or middle section of the kidney do not typically pass spontaneously. However, stones in the distal ureter are more likely to pass on their own. So what caused John's kidney stone? Kidney stones, also known as renal calculi or nephrolithiasis, are solid deposits of minerals and salts that develop within the urinary tract or kidneys. The most common types of kidney stones are mainly composed of calcium oxalate and phosphate, while less common types include uric acid, cystine, and struvite stones. Many factors influence the development of kidney stones, making it a complex occurrence. One dietary factor is consuming foods that are high in substances such as calcium, oxalate, and salt. Inadequate fluid intake can also lead to concentrated urine, which promotes the solidification of minerals and salts. Other factors include medical conditions that cause excessive levels of calcium, oxalate, or uric acid in urine, genetics, and obstruction or stagnation of urine flow. John's kidney stone was likely caused by insufficient fluid intake. He admitted to not drinking enough to avoid making frequent stops while driving his truck. Since the urologist recommended conservative management to allow the stone to pass on its own, John was admitted to the observation unit. His treatment plan includes pain management, anti-nausea medication, broad-spectrum antibiotics, and intravenous fluids. He was also instructed to strain his urine to collect any stone fragments. With pain management, John's pain gradually improved. He regained his ability to eat and drink, and his repeat blood tests showed a decrease in white blood cell count and an improvement in kidney function. A urine culture also showed no bacterial growth, so John's antibiotic was discontinued. John's kidney stone passed spontaneously on the second day of his hospital stay. He collected the stone fragments in the urine strainer. A follow-up kidney ultrasound confirmed the resolution of hydronephrosis. John was discharged with pain medications and instructions to stay well hydrated and strain his urine to collect any stone fragments. As we conclude this case study, I thought it would be interesting to share some facts about kidney stones. They're a fairly common condition. affecting about 10% of people at some point in their lives. Those who live in hot and sunny climates are more susceptible to developing kidney stones due to the risk of dehydration. Did you know that the largest recorded kidney stone weighed over 2.5 pounds, which is equivalent to 1.1 kilogram? Thank you for your continued support and for being a part of my channel. I hope to see you again soon.